Definition. So, bedpan is an object used for the toileting of a bedridden patient in healthcare facilities. So, usually made of metal, glass, or plastic receptacle. So, a bedpan can be used for both urinary and fecal discharge. So, purposes. So, purpose number one is many diseases can confine a patient to bed, necessitating the use of bedpan. So, number two is additionally, many patients may be confined to a bed temporarily as a result of a temporary illness, injury, or surgery, thereby necessitating the use of a bedpan. So, suggested action principles are rationale. So, number one, wear disposable gloves. So, if needed, you need to wear disposable gloves because you're doing contaminated procedure. Number two, if the bedpan is metal, warm it by rinsing it with warm water. So my bedpan is metal. I already rinsed it with warm water. So next, adjust the bed to appropriate height to prevent the back strain. So I don't have a bed, hospital bed. So number four, elevate the side rail of the opposite side to prevent the client from falling. So for example, I elevated from falling out of the bed. So number five, ask the client to assist by flexing the knees, resting the weight on the back, and helps the client on the heels and raise the buttocks of using the trapeze bar in present. So sir, pa-flex po ng knees niyo po. Okay. So next is help lift the client as needed by placing one hand under the lower back, resting your elbow on the mattress and using your forearm as a lever. So sir, pataas po tayo. 1, 2, 3. Yan po. So next is put the pillow. Okay. So 7, lubricate the back of the bedpan with a small amount of hand lotion or liquid soap to reduce the tissue friction shearing. So I'll use this. Okay. Next will be place the sheet under the client. So sir. Okay. So place a regular bedpan so that the client rests on the smooth founded rims. Place a sleeper pan with the flat lower end of the clean and buttocks. So sir, I'll change your ano po. So I changed the linens for the fecal procedure. So step number 9, for the client who cannot assist, obtain assistance of another nurse or place the client on his or her side. Place the bedpan against the buttocks and roll the client onto the bedpan to help lift the client onto the bedpan. So, I'll place the bedpan. So, sir, pataas ko ng buttocks. Okay. So, next, I'll replace it na. So, number 10, elevate the client bed on semi-flower position if permitted. If elevate is contraindicated, support the client back with a pillow as needed to provide more normal position for the client lower back. So, sir, pataas po. Okay po. So, next, rationale to prevent hyperextension of the back. So, number 10, cover the client with bed linens to maintain comfort and dignity. So, number 10 is provide toilet tissue placed at the call light within reach lower bed of the. So, sir, ito po yung tissue nyo. To the low position elevated at the side rail if indicated and leave the client alone. So, next is step number 13, answer the call bell appropriately. So, leave the client at least 15 minutes. So, don't leave the patient longer than 15 minutes. So sir, iwan ko muna kayo. So, do not leave anyone on the bedpan longer than 15 minutes. At least they are able to remove the pan themselves. So, sir, iwan ko muna kayo para po po kayo, rectal. So, rationale, lighted stays on the bedpan can cause pressure ulcer. So, hello sir, tapos na po kayo. So, number 15, when removing the bedpan, return to the bed to the position used when giving the bedpan. Hold the bedpan steadily, cover the bedpan, and place it on the adjust chair, holding the bedpan steadily. So, remove the bedpan na po. So, this is the. So, next is if the client needs assistance, then gloves and wipe the patient lips. So, first, we're going to put it on the bathroom. So, I'm done. Next is wipe the patient rectal several toilet tissue if specimen proof is needed. Place the tissue if acceptable other than the bedpan. So, sir, bend po kayo. Puto po sa left side niyo po. And taas niyo po to yung legs niyo po. Okay. So, this is the toilet tissue. So, okay. Well, at least. So, yan. So, we're going to collect. Okay. So, after that, you need to get rid of and put it in the trash bin. Number 17, wash the perineal area of dependent patient with a soap and water and truly dry the area. So, next will be the number 18. For all the patient, warm water, soap, and washcloth, and a towel to wash the hands. So, sir, this is the wipes po. To wash your hands po. Ito po. So next is number 19, assist the client to comfortable position, empty and the cooling bed pan and return it into the bedside. So sir, is na po kayo? Bigyan na po kayo ulit sir. Okay. So next is remove the discharge gloves and wash hands to prevent spread of infection. So putting back the bed linens. Okay. So step number 21, spray the room with a air freshener as needed to control the odor and least contraindicated because of respiratory problems or allergy. So step 22, document the color, odor, amount, and consistency of the urine and feces and the condition of the perineal area for references. So, sir, thank you for today, sir. I'll go back. I move the soap, sir. Ako po kayo. So, that's all po, sir. Thank you po.